Welcome to the Neurostimulation Podcast. I'm Michael Passmore, Clinical Associate Professor in the Department of Psychiatry at the University of British Columbia. The Neurostimulation Podcast is all about bringing cutting-edge neuroscience, research, and education to you free of charge. Every week, we're going to explore the fascinating world of neuroscience and neurostimulation, how it works, the latest research breakthroughs, and, importantly, how that research is being translated into real-world treatments that can improve health and well-being. So whether you're a healthcare professional, a student, or just someone who's interested in how our brains work and what we can do to help them work better, this podcast is for you. My mission is to make the science accessible, inspiring, and relevant to your life. As part of my commitment to evidence-based analysis, every episode that we review a study will involve an advanced critical appraisal of the study. If you're not interested in this deeper dive into issues like methodology and statistical analysis, feel free to skip ahead on the timeline to other aspects of the discussion that you're more interested in. This podcast is separate from my clinical and academic roles and is part of my personal effort to bring neuroscience education to the general public. Accordingly, I would like to emphasize that the information that I share in this podcast is intended for educational purposes only and not as medical advice or a substitute for professional medical guidance. Always consult with your own healthcare provider to discuss your particular health needs and treatment options. By listening to or watching this podcast, you acknowledge and agree that any decisions related to your healthcare are your own responsibility, and I recommend that you make those decisions in consultation with a qualified medical professional. This episode is presented by Zip Stim Neurostimulation. Full disclosure, Zip Stim is the neurostimulation clinic that I own and operate. You can find out more about our clinical neurostimulation programs at zipstim.com. That's zipstim.com. Now on to the next episode. Today we're exploring a really exciting area of research, how transcranial direct current stimulation, or tDCS, is being used to address chronic pain in people with fibromyalgia. Before we dive into the study itself, let's start by understanding what fibromyalgia is and why treatments like tDCS might hold so much promise. So what is fibromyalgia? Fibromyalgia, or FM for short, is a chronic condition that causes widespread pain throughout the body. But it's not just about the physical discomfort. It also brings symptoms like fatigue, sleep disturbances, and problems with memory and concentration, a condition sometimes known as the fibro fog. It's a huge condition that can take a major toll on a person's quality of life. Everyday activities, from going to work to spending time with friends and family, can become incredibly challenging. Fibromyalgia affects an estimated 2 to 4% of the population, and it's more common in women than in men. Despite its significant prevalence, it's often misunderstood and misdiagnosed, leaving many patients feeling frustrated and unheard. Now, here's the tricky part. Treating fibromyalgia is far from straightforward. There's no single cause of fibromyalgia, which means there's no one-size-fits-all solution. The pain seems to stem from an overactive nervous system, where the brain and spinal cord amplify pain signals. Traditional treatments include medications like antidepressants, anticonvulsants, or pain relievers. While these medications can help, they don't work for everyone, and they often come with side effects. Then there's physical therapy and exercise programs, which are beneficial, but can be hard for patients to sustain, especially during flare-ups. There's cognitive behavioral therapy, or CBT, to help manage the emotional toll of chronic pain. Despite these options, many patients continue to experience significant pain and they struggle to find effective relief. This is why researchers are turning to innovative approaches like neuromodulation, where brain activity is directly targeted to reduce symptoms. So what is tDCS? Let's review that. If you haven't had a chance to watch episode 2, we also talked about tDCS as a non-invasive brain stimulation technique that uses a low electrical current to modulate brain activity. It's simple but surprisingly powerful. Small electrodes are placed on the scalp that deliver a current that alters the activity of neurons in specific areas of the brain. For fibromyalgia, the most promising target is the primary motor cortex, or M1, a part of the brain involved in pain processing. By stimulating this region, researchers believe that tDCS can help reset the overactive pain pathways that contribute to fibromyalgia. The study we're focusing in on today takes a deep dive into whether tDCS can be a reliable treatment for fibromyalgia. Researchers conducted a systematic review and meta-analysis, meaning that they combined data from multiple other clinical trials to get a clearer picture of how effective tDCS really is. Their goal was simple but important: to determine whether tDCS can significantly reduce pain in people with fibromyalgia, identify the most effective protocols, and highlight areas for future research. So what makes a systematic review so valuable, and what did the researchers analyze to reach their conclusions? Systematic reviews and meta-analyses are like the gold standard for combining evidence from multiple studies. They help us to figure out what's really going on in the big picture. And that's exactly what the researchers did here. So what is a systematic review, and what is a meta-analysis? A systematic review starts with a question. In this case, does tDCS reduce pain in fibromyalgia? The researchers then scour the scientific literature, selecting only the most relevant and reliable studies to answer that question. Once they've gathered these studies, a meta-analysis takes it further by pooling data to calculate an overall effect size, kind of like averaging grades to see how a whole class did on a test. This approach not only saves time, but it also increases confidence in the findings because it's based on more data than any single study could provide. So how did they do it? The researchers followed a rigorous step-by-step process. First, they had a database search strategy. They searched 7 electronic databases, including PubMed, Scopus, and Cochrane, to identify relevant studies. They used specific keywords like tDCS and fibromyalgia and pain to cast a wide net. In terms of inclusion criteria, only studies that focused on adults with fibromyalgia who received tDCS treatments were included. They excluded studies that didn't use proper control groups, like sham stimulation, or those studies that lacked clear pain outcomes. In terms of the statistical analysis, to account for differences between studies, the researchers used a random effects model. This method is perfect when studies vary in design or population, as it adjusts for those differences while still finding an overall trend. In total, they identified 20 studies that fit their criteria, but only 11 were included in the meta-analysis. In total, they identified 20 studies that fit their criteria, but only 11 were included in the meta-analysis. These 11 studies provided enough data to perform a detailed statistical analysis on tDCS's effects. So who were the participants? The studies included a mix of men and women diagnosed with fibromyalgia for at least 3 months. The total sample size across all studies was 664 participants, with 443 receiving active tDCS. This broad range of participants helps to ensure that the findings are relevant to people living with fibromyalgia. But keep in mind that most participants were relatively healthy beyond their fibromyalgia diagnosis, so the results might not apply to individuals with more complex medical conditions. Let's talk about the tDCS parameters that they focused on. The target area was the left primary motor cortex, or M1. That was the most common target area in these studies. This area is known for its role in pain stimulation. Let's talk about the tDCS parameters that they focused in on. First, consider the target area. The left primary motor cortex, or M1, was the most common target. This area is known for its role in pain modulation. Then there's stimulation intensity. Most studies used a current of 2 milliamps, which is a safe and effective level for modulating brain activity. Then there's session duration. Treatments ranged from 20 to 30 minutes per session, typically delivered over multiple sessions across weeks. In terms of outcome measures, the main focus was on changes in pain intensity, measured with standardized tools like the visual analog scale or the numerical rating scale. These tools let participants rate their pain before and after treatment. Why this method matters? This systematic approach is critical for making sense of a complex topic like fibromyalgia treatment. By combining data from multiple studies, the researchers were able to draw stronger, more reliable conclusions than any single study could provide. Why this method matters? This systematic approach is critical for making sense of a complex topic like fibromyalgia treatment. By combining data from multiple studies, the researchers were able to draw stronger, more reliable conclusions than any single study could provide. Now that we've set the stage with the study design and methodology, it's time to answer the big question. Did tDCS actually help reduce pain in people with fibromyalgia? Let's dig into the findings and analyze what they mean for pain management. The results are really exciting. tDCS significantly reduced pain intensity in fibromyalgia patients compared to sham stimulation. This wasn't just a minor improvement. The effect size was notable, with a standardized mean difference, or SMD, of negative 1.55. In simple terms, that means that the reduction of pain was not only statistically significant, but also potentially meaningful in a clinical context. What was the most effective protocol? The study also pinpointed the most effective setup for tDCS. In terms of the stimulation target, the left primary motor cortex, or M1, which is the region known for its role in modulating pain signals, making it a local target for fibromyalgia treatment. In terms of the stimulation intensity, 2 milliamps was the sweet spot. This current strength is commonly used in tDCS research and is known to be both safe and effective. In terms of session duration and frequency, while the exact protocols varied, the most common approach involved daily sessions lasting 20 to 30 minutes, typically delivered over 1 to 2 weeks. By identifying these parameters, the study offers valuable guidance for clinicians who are looking to implement tDCS as part of a pain management plan. Was there any evidence of publication bias? One common concern in meta-analyses is the possibility of publication bias, the idea that studies with negative results are less likely to get published, skewing the overall findings. The good news here is that the researchers found no evidence of publication bias. This adds confidence that the results are a true reflection of the available data. How about clinical significance versus statistical significance? We'll get into this into more detail in the later section, but for now we'll talk a bit about the difference between statistical significance and clinical significance. In terms of statistical significance, the SMD of negative 1.55 tells us that the pain reduction was unlikely to be due to chance. But what does this mean for actual patients? A reduction of this size could translate into a meaningful improvement in daily life, making tasks like walking, working, or sleeping easier for patients. It's worth noting, though, that fibromyalgia is a complex condition, and while tDCS might not completely eliminate pain, it could provide significant relief for those who don't respond to other treatment options. So what does this mean for pain management? This study highlights that tDCS is a promising tool for managing fibromyalgia pain. It offers a non-invasive neurostimulation, drug-free alternative that could complement or even potentially replace traditional treatments for some patients. However, it's important to remember that these findings are just a starting point. Further research is needed to refine the protocols and understand the long-term effects. Now that we've unpacked the study's findings, let's shift gears and critically evaluate its strengths and limitations. There'll be a more detailed critical appraisal in an upcoming section of this podcast, but this is a brief critical appraisal introduction to look at the strengths and weaknesses of the study. Let's start with what the study did really well. The first thing is a comprehensive literature review. The researchers followed PRISMA guidelines, that's PRISMA, P-R-I-S-M-A. These guidelines are the gold standard for systematic reviews. They meticulously searched multiple databases, ensuring that they captured a broad range of studies. This thoroughness minimizes the risk of missing important data. The second is robust statistical analysis. By using a random effects model, they accounted for variability between studies. This method is ideal when dealing with different protocols or patient populations, making the results more reliable. The third thing is no evidence of publication bias. One of the biggest concerns in meta-analyses is that studies with negative results might not get published, skewing the overall findings. The researchers here address this by using tools like funnel plots and Egger's test, confirming the integrity of their data. What about limitations of the study? Let's talk about where the study could have been stronger. The first thing is small sample sizes in individual studies. While the meta-analysis included 20 studies, the number of participants in each study was often small. This limits the statistical power and makes it harder to generalize the findings. For example, the total sample for the meta-analysis was 664 participants, but individual study sizes ranged widely. The second thing is variability in protocols. The included studies used different tDCS protocols, different durations, different intensities, and different electrode placements. While the meta-analysis suggests that a 2 milliampere stimulation over the left M1 area is the most effective, the variability adds noise to the results and makes it harder to draw firm conclusions about the best approach. The third thing is lack of long-term data. One glaring gap in this study is the absence of long-term follow-up data. Most studies measured pain relief shortly after the treatment period, but we don't know if these effects last weeks, months, or years. Chronic conditions like fibromyalgia require sustainable treatments, so this is a critical area for future research. How about generalizability? Another important point to consider is whether these results apply to all fibromyalgia patients or not. What about population diversity? Most participants in these studies were relatively healthy adults with fibromyalgia. But what about people with more severe symptoms, coexisting medical conditions, or older adults? How about the real-world settings? These studies were conducted in controlled research environments. How well would tDCS work in a typical clinic or at home, where factors like equipment variability or patient adherence come into play? Looking at balancing the strengths and limitations. Overall, this study offers strong evidence that tDCS can reduce pain in fibromyalgia patients, but the limitations remind us that it's just one piece of the puzzle. The findings are promising, but they're not definitive, and that's okay. Every study contributes to a growing body of knowledge that we can build on. Thanks again for joining me today on the Neurostimulation Podcast. I hope that you enjoyed this exploration into the fascinating world of neuroscience and neurostimulation research as much as I did. If you found this episode interesting, don't forget to like and subscribe to this channel and podcast. It's the best way to make sure that you never miss an episode, and it also helps us to reach more curious minds like yours. If you think that this episode might resonate with a friend, family member, or colleague, please share it with them. Knowledge is better when it's shared, and you never know who might benefit from this information, who might find it inspiring or helpful. For more details about the research that we discussed today and the associated technology, please check out the links in the show notes below. You'll find everything that you need to dive deeper into this particular topic. And I'd love to hear your thoughts. Join the conversation in the comment section below and/or reach out on social media. Your questions, ideas, and feedback make this podcast better. Finally, don't forget to tune in to the next episode. It's going to be another really interesting and exciting journey into the cutting edge of neuroscience and neurostimulation. Thanks again for watching and listening. Take care, and I'll see you next time on the Neurostimulation Podcast.